بسم الله الرحمن الرحيم. السلام عليكم. احنا ان شاء الله باذن الله هنشرح النهارده اليونت اسسمنت، وهيكون معاكم دكتوره يسري، مدرس مساعد بقسم اداره التمريض. تمام. I will start to explain the unit assessment for the student. The unit assessment is very important for you to determine the needs and strengths and weakness point in the unit. To improve it, after determining the strengths and the needs of the unit structure, you can determine the point that this unit needed to improve the care that provided for the patient. Okay? There are general rules for the student and note. Through clinical unit assessment, student will be familiar with entire unit structure and culture to further student clinical duties and activities. General rule, your comments are possible for the abnormal observation. Explanation only. Meaning that the students should write the comment after his answer or her answer to support and explain the answer. Okay? Which type of service that this unit provided it? The services of this unit: medical, surgical, or maternity, or pediatric, or others. The second item, levels of patient care. Which levels of patient care in the unit that you are present in it? General care unit, or intermediate care unit, or intensive care unit, or mix. You can determine that. Number of rooms in the unit. Shape after you can present it in it. Okay. The majority of the unit are U-shape. After that, you can determine the number of patients per unit. Okay. Item number 7, physical environment. Meaning that physical environment contain 2 items that you can determine if this unit quiet environment or noise, and you can determine quiet environment always or sometimes or never. You should write comment to support and explain your answer. The second item in physical environment, clean lens. Clean lens contain walls, floors, linens. You can determine if walls clean always or sometimes or never. You can determine the floors clean always or sometimes or never. You can determine linens in the unit clean always or sometimes or never. After that, you write the comment to support your answer. Item number 3, in physical environment, ventilation. If this unit has excellent ventilation or good ventilation or poor ventilation, you should write comment to explain your answer. Item number 4, in physical environment, light. Light contains 2 items, sunshine and lamps. How? You can write if this unit has sunshine or the sunshine can enter in this unit through windows, through doors. Okay? Lamps in this unit have good light or not. You can write comment to support and explain your answer. Next, in patient's room, this 5 items in physical environment present next in patient's room or not present, and you should write the comment to explain and support your item. Item number 8 in unit assessment, word layout structure include this meaning that the unit should be have these items in the structure. You can determine if these items present or available or not available. You can determine these items available or not available in the unit that you can attend it in it. Okay. Number A, nurse station. Nurse station for nursing, available or not available. Examination room for examine the patient, available or not. Conference room available or not available in this unit. Utility room. Utility room meaning store for supply or equipment, present or not present in the unit. Serving kitchen room, available or not available. Relative visitor room, available or not available in the unit. Praying room, available or not available. After you determine the availability of previous items, you should write the comment to explain and support your answer. The paramedic service, item number 9 in the unit assessment. You can determine this item centralized or decentralized. You can determine centralized or decentralized after you knowing the meaning of centralized or decentralized. The pharmacy in the unit may be centralized or not. Diagnostic radiology, centralized or decentralized. Laboratory in the unit, centralized or decentralized. Blood bank, centralized or decentralized. Sterilization services, centralized or decentralized. Decentralized meaning that the units have all these items for it and disconnect with all hospital or all organization. But centralized meaning the unit follow the hospital and share the services with all hospitals and other units. Physiotherapy, centralized or decentralized. Maintenance services, centralized or decentralized. Laundry services, centralized or decentralized. Dietary, centralized or decentralized. Social services, centralized or decentralized. Item number 10. Written materials in relation to. After you attended and present on the unit, you can determine there are policies and procedures manual book and posters present or not present in the unit. Each unit should be have policies and procedures and posters, or that all that present or not present. Kind of policies, procedures and posters present or not present, and which kind of policies and procedures and posters present in the unit. You should write comment to support and explain your answer. Item number 11 in unit assessment, safety environment. Safety environment, if this unit safety environment or not, by which you can determine bedside rails present or not present, floor condition is dryness or slippery. You should write comments to support your answer. Item number 12. Which safety devices? Fire extinction, fire alarm system, sharp container. All of these items present or not present. Patient's privacy. Patient's privacy presented in private bathroom or curtain. Private bathroom present or not present. Curtain present or not present. Medical equipment, you can determine the availability of equipment in the unit, adequacy of equipment in the unit, quality of equipment, and maintenance. Is that okay for this equipment or no? You can write comment to support your answer. Medical supply, you can determine the availability and the adequacy for it in the unit. Item number 17. The first line nurse manager, you can determine. First line nurse manager meaning that the head nurse. You can determine the educational preparation for the head nurse. If educational preparation for the head nurse, bachelor degree or diploma or others, and you can determine the years of experience. You can collect this data from interview with the head nurse and ask her about that. Okay. The staff nurse. Which educational preparation for the staff nurse? And which years of experience for the staff? You can determine the years of experience for the staff. They all have a bachelor degree or diploma or others. Okay. Average number of nursing staff and auxiliary staff for their shift. After you presented and attended in the unit, and you can speak with the staff and make interview with them. Do determine and know which shift that the staff follow it. Morning shift, evening shift, and night shift, or long day and night shift. After you can determine the type of shift, you can ask staff or head nurse about the number of staff nurse that presented in the shift, and nurse aid and tech. Ratio of nurses to patients. You can ask the nurses about that. Okay. And from your observation, you can determine the number of the staff presented in the shifts and the patients presented with the nurse in this shift. Item number 21. Which type of nursing staff in the unit? Basic staff or supplementary staff or mix? Which type of nurse aiding? Nurse aiding. Basic or supplementary or mixed? Which is a method of assignment? You can determine the method of assignment after you take the lecture about patient care delivery system. And after you know what is the meaning of case method or functional method or team method. And this method of assignment depend on the type of the unit. The unit for ICU follow the method of assignment different from different different, and the unit for medical or surgical have the method of assignment different from any unit. Okay, and you can write comments to explain your answer. From the staff nurse to head nurse, or from head nurse to supervisor. Horizontal flow communication, meaning that the line of communication between the same position, between the same level of authority, like the communication between the staff or the communication between head nurse to head nurse. Diagonal flow communication, meaning that different communication between a low and a high position and a different position to achieve the goal of the organization. Okay, you can determine the type of communication channel that presented in the unit. You can determine from your observation if the first line nurse manager or head nurse in the unit that you presented in it make supervisory skills for her staff or no. And you can determine if he makes the supervisory skills done or not done or sometimes done. Okay, and write the comment to explain your answer. Item number 27, affiliation of the hospital with the Faculty of Medicine. Yes or no? Item of 28, the type of which is the type of affiliation of medical staff. Closed staff, meaning that rely on upon القصر in medical staff, or open staff, that meaning rely on any type of staff. Item number 29. Affiliation of hospital with colleague of nursing, yes or no? Thank you. واحنا لحد كده خلصنا خلاص الايه شرح اليونت اسسمنت، وبالتوفيق ان شاء الله، والسلام عليكم ورحمة الله وبركاته.